I'm now bringing the City Council into session, April 15th, 2020. Thank you all for joining us. And I'm going to go through the logistics of this again for the public who may be tuning in. So thank you all for joining us in this new remote meeting format we're using in response to Governor Brown's Stay Home, Stay Safe order. This format enables the City Council to meet and take care of business while keeping its members, staff, and the public safe. For work sessions like this one, where there is no opportunity for public comment, those wishing to access the meeting can do so by watching the live stream available on our website, the broadcast on Comcast Channel 21, or by calling into one of the phone numbers listed for this meeting on the public webcasts and meeting materials webpage. And that is eugene-or.gov/3360. And as always, other avenues of communication with me and city councilors are available, including email and voicemail. And so thank you so much for tuning in and joining us. And now I see we have Emily and Claire and Mike. Happy to see you all there. Okay, we have our first order of business is a COVID update, but the manager has prompted me just to do a calendar check with you, which is on Monday. We're scheduled in the 7:30 meeting to talk about, for you to do your interviews on boards and commissions. That's not a regularly scheduled 5:30 meeting unless there's a reason to have a meeting that day. And so there's nothing currently scheduled, and we're thinking of just leaving it that way, if that's okay with all of you. So you would just on Monday have the 7:30 meeting.
Yeah, the only thing that's on there right now is the COVID update, which you're going to have plenty of this week, I think.
Right. We can probably get through that. And if there's really breaking news, you can always send us a memo and let us know. So, okay, so with that, I think we are ready to begin with our first item, which is Chief Heppel and the COVID-19 update.
Great, thanks, Mayor. Give me just a minute. Let's see if I can share my screen with you really quick. Hopefully folks are able to see the full screen and it's actually in presenter mode, yes?
Yep, looks good.
Great. And so, Mayor, Council, good morning. Great to be back in front of you again, or I guess this is good afternoon. So we're just a quick reminder, we're now into week 5 of the COVID. We opened up our response to this on March 13th, and we're continuing to process through. And I'm going to start off with just some of the numbers. We'll start off with just Lane County really quick. So current total cases, we have 45 positive cases with 15 folks who have recovered. We have 7 hospitalized, 1 death, and we have 22 that are resting at home. At this point, we know we have completed at least 1,643 tests, and this information comes directly off of the Lane County Public Health website, where I just took it from. Why I brought this up specifically is the data that started to be reported last week of recovered, and I think that's a good piece to note, is that our folks who were susceptible and infected early in this process or early in this incident. And now we're starting to see people recovering and rolling out of that. So, using my quick math, 45 folks and 15 recovered. So we have those 30 with the 1 death. And the other piece is 7 hospitalized. And the fact that we have 3/4 of those folks resting at home, those 22, as medically stable is a good indication that we're doing what? And that is we are flattening that curve. So that's where we're at right now in Lane County. For more information on some of the data sets, et cetera, I sent you all an email this morning that had some data resources. Hopefully that quenches your thirst a little bit when it comes to wanting to see some charts and graphs. And those are literally the ones I look at on a daily or multiple times a day basis to see where things are going. Can't reiterate enough that it's still very fluid. And they're updated regularly, all of those resources, sometimes multiple times a day. The other part is data accuracy, right? So as we only have 45 cases in Lane County. So the more cases and more experiences that we have across the country can help improve the accuracy of that data. But I'll leave those things up to you all to go out and reach and learn about. And if you have some specific questions, certainly feel free to reach out to me. I'd love to have a discussion on data sets. I think it's pretty interesting stuff. Also spoke a little bit via email to you this morning about tests. So there's kind of a misconception out there. We hear a lot about these test kits that are available from the CDC and why don't we have them, et cetera. Or why is our testing not been elevated or brought up in terms of capacity? And it continues to be our access. It's not necessarily the machine perspective as much as it is what's called the reagent, which is, which what that does is allows the test to actually process through. So I gave you some notes in there as to what a reagent is and why it's difficult for them to get, along they being the testing facilities, because it's simply in high demand. The example that I utilize is many times disasters are geographically based. So if you consider like a hurricane or an earthquake, and all those unaffected areas can now send their resources in to help that affected area. But in this particular case, we have a pandemic. So this is worldwide and is affecting everyone. So it's a simple supply versus demand curve. And with us not being one of the epicenters, and hopefully we never become an epicenter for this, a lot of the available resources are going to those places to help them fight the coronavirus, to identify, isolate, and flatten their curve. So that same philosophy occurs with the personal protective equipment as well. So that's why we see much of that equipment diverted to other directions under FEMA and the federal government side of the house. But I could tell you that we still continue to be in a good place when it comes to personal protective equipment here in Eugene. And that certainly we haven't had a single responder go out without the proper equipment to this date. And certainly my goal is to keep going with that. And I'll talk a little bit more later about that. Some other pieces on testing. Sent the U of O released a news release this morning about they're going to start doing some testing. Their incident commander and their deputy incident commander addressed that yesterday during a clinician's briefing. They're hoping to get that up and running, where they've gone out, purchased some equipment, and from all their research folks, they're like, hey, we've got the skill set, we can do that, and we can help out. So that's a huge piece that they're bringing to our COVID fight here locally. And they've gotten into a relationship with, or established a relationship with McKinsey Willamette to assist them in testing. So they reported to us, they're looking to start doing like 100 tests a day and then to start ramping up from there. So we look forward to that being added to the slate as well. Peace Health reported yesterday at the same clinicians group that they're also doing testing on patients who are admitted through the ER. So folks that are admitted are getting tested as long as there's still some criteria that had to be met. And the purpose of that is so that they, in their setting, can isolate patients, those ones with respiratory or potential COVID cases or actual COVID cases. They can isolate by ward or floor, again, to manage the spread of the disease. So the good news is we still have those relatively known numbers, and we hope that it stays that way. So we've certainly done our part here in the local community with flattening the curve. And again, I'll talk about that here in a little bit. We continue to work with our partners from Lane County as our lead agency, with Public Health, Oregon Health Authority, City of Springfield, and certainly some other stakeholders like University of Oregon. Some folks, you all were asking some questions about the University of Oregon and what's their wedge in this pie. And so the U of O is actually what we call a cooperating agency, and they're connected through our partnership with Lane County. The U of O liaison officer actually participates in the county partner calls, and the U of O incident commander participates with me on the county incident commander weekly briefings and other calls that we may have as well. What they brief as their primary focus right now is they're really focused on the remote instruction of classes, which we've seen across the whole country. The care and feeding of the limited number of students they still have on campus, as well as supporting remote administrative and research work where it's feasible, and trying to maintain limited critical resources on campus where their remote work isn't feasible. You should have also received that email from Matt Roberts about their coronavirus testing. Next question that was asked was, what about U of O facilities? In terms of the possibility of using U of O facilities, that would be something that would come through the partnership with the county. So that's that relationship there. If you look at it from our incident command structure, and we have our emergency operations center, they have an emergency operations center that would report to Lane County. I report to Lane County, Springfield reports to Lane County, and we work collaboratively and cooperatively from that perspective. So there's not necessarily a direct connection between me and the other IC. We work together, but it would come through Lane County. Certainly, we continue to work with Lane County and take guidance from CDC recommendations regarding the best strategies for this pandemic, and that is really not to disturb what we have going on right now. So our current focus is still on forming the small, physically distanced, designated temporary shelter sites that give folks a safe place where they can receive mobile outreach from our teams. Instead of and that's an avoidance to not create large congregate type of facilities, which could actually end up promoting the spread. So really our actions, if you recall, are focused around 4 things, and we're continuing with that effort. One is our hygiene component, and that's why we see our distribution of porta potties, as well as our hand washing stations, et cetera. The next piece is our outreach teams. So those folks that are not in our designated temporary shelter sites, we're going out to, and I'll have a few more numbers on that here in a little bit. The third piece is our distribution center out of Whitebird. And then our fourth piece is the designated temporary shelter sites. So we've had that process. We've started down that road a couple of weeks ago. We're going to continue to implement that process. And I think just from the numbers I just reported, we're being pretty successful in collaboration with our partners on this effort to keep that curve low, staying home, staying safe, and we're certainly saving lives. So as we've gotten into a solid month of this process, I'm going to walk through our FLOP again. Remember, so that's our general staff, which is our finance, logistics, operations, and planning. I'm going to kind of stick with that. I will sign off your Incident Command 100 cards at the end of this with all the education you're getting from me. That'll be great. And so let's start off with finance. That's always a question. With that, so our cost to this point, so as of the 13th of this month is $1.9 million. We break that down into 2 categories for you. $528,000 of that is non-budgeted costs, and these are things such as our personal protective equipment, shelter supplies, contracts, some limited overtime, etc. The $1.4 million is regular employee personnel costs other than overtime. One piece to note is that this is already budgeted hours. However, we have to recognize there are some opportunity lost causes there. As many of the other execs have offered their staff to come help me in the EOC, we have to recognize that their folks are not there doing their normal job. Other people are having to pick it up, et cetera. If we look at our projected costs at the 60-day mark, that's approximately will be at approximately where we're going to be at. It says 6.4 million, but 4.6 of that again is the budgeted cost of employee personnel. Another piece that I'm asked is, so what are the shelter costs? So at this point, the shelter costs have been $64,000 for the shelters plus the distribution site to date. The next question is, what about reimbursement? So certainly our finance team is looking heavily at that. A couple of reimbursement components. One is we've heard of the CARES program. So CARES can come in through different venues. It's a very complicated system. I don't have the expertise to delve into that, but that would incorporate some pieces for businesses, housing. There's potentially some pieces there for emergency medical services, et cetera. The big one that we always look at is through FEMA, through the Stafford Act, which was enacted early on in this. That's how we normally receive our reimbursement through disasters. that typically is a 75% reimbursement with a 25% cost share. So much of the non-budgeted items, we feel, talking with finance, it will be a strong candidates for reimbursement. However, one thing I would caution us is recognize this is a nationwide issue. So while we're going to file for reimbursement at the appropriate times, it could be a couple of years before we see some of that reimbursement coming back in. So let's be cognizant of that piece. But the good news is there are some pieces in place for that. Moving on, we'll talk about logistics. So as a reminder, this is our team that's focused on, getting the supplies and the staff needed, getting them to where they need for our response. So I talked again about the hand washing stations, et cetera. Our number's gone up. We have 73 deployed now and 58 hand washing stations throughout the city, including downtown as well as our parks. And you will also see that in the GIS layer on the city website. That's available to you for locating where those things are at. We also implemented a sanitation branch. So we have someone that's actually dedicated to managing those, et cetera, and seeing what our needs are. If you see the picture on the right, the picture of me there, I'm actually opening up a box of what are called KN or Kilo November 95 masks. And we received 8,000 of those earlier this week. And so this is an attribute to the logistics team and their aggressiveness and the fact that we were able to get a shipment or obtain these literally as quickly as we did, considering the demand for these types of masks. What we're able to do is, in this case, is these masks are great for the everyday use. So all of our city staff who need a product like this. So we're taking these and redistributing these back down to our department operations centers or our departments within the city. Why that's important is because early on, we asked other departments, we being the fire department, asked other departments and said, hey, if you have any N95 masks, please send them up to us because we're dealing with direct patient contact. And it says a lot for the sheer number that came up from all the different departments that they gave to fire. And so we worked pretty aggressively. Now we're returning that favor and pushing them back down again. So that's a tribute to the success and the team in this particular case. So pretty excited about that part. Let's talk a little bit about operations. So remember the operations, they're focused on that 4-prong approach. So the hygiene, supplies, outreach, shelter, et cetera. The distribution center at Whitebird has been open for just a day or two over a week, serving all vulnerable populations. So far, we've seen 430 people come through our distribution center. 374 of those were first timers. So we had a couple of repeat folks, but the disproportionate amount of those 430 are individual folks. Handed out more than 200 tents, sleeping bags, and some other products, water, food, et cetera. Our outreach teams, absolutely would love to throw a shout out to them. The work they're doing and in the environment and stepping up to the plate every day along with everybody. The outreach teams, though, are out there in the field making those connections. And so far, they've had 270 site visits at different locations or camps through all of our neighborhoods across the city. And they've given away or provided up to 700 basic need items. And these would be basic things such as soap, shampoo, toothbrushes, socks, hygiene wipes, et cetera, are just some of the common products that we're helping to distribute out to our vulnerable population to keep them staying in place as we continue to navigate through this process. Our 2 designated temporary shelters, or DTSSs, at Hilliard and Amazon are full. So far, we have 9 people staying at each site, and it's interesting to watch the dynamics, is because they're starting to come together as their own communities. Now, come together in terms of keeping their physical spacing, but as groups, they're starting to come together as a team. At the site at Peterson, so it started with car camping, and we'll have those 6 tent sites over the next few days. And again, this site will be managed similarly as the Hilliard and Amazon sites. with our social service provider, Whitebird, and carry it forward. So let's talk a little bit about planning. So there are folks that continue to ensure that we have our proper documentation and make sure the event is all captured for potential future federal reimbursement, which I just talked about. Over the last couple of weeks, I've talked about the GIS layer. So here's here's an example of that. We've also been, I'll go back to our teams a little bit, our outreach teams. They've also been tracking in a app where their site camps have been and number of people serviced, and does anybody appear to be sick or any other necessary needs, et cetera. And we've captured that in a GIS layer too. And they've been using that by an app that was created by our city GIS folks. So kudos to them in helping us track all of those. As well as they've been starting to shift a little bit of their thoughts. So one of the pieces that they're looking at is they're starting to shift to the long-term community recovery process and what that looks like, including potential triggers to start demobilizing. So, in the IC incident command structure, we use the term demobilization, which means we start to drive our way back to normal. We start to put the pieces back to where they were before we brought them all together to create the EOC. We start to transition projects back. We start to transition resources back, responsibilities, et cetera. And that needs to be done in a coordinated effort. And I'm going to talk a little bit about that here, more here in a little bit. So next, looking ahead. So let's look ahead a little bit. So the EOC is currently talking about the cloth mask. So that came up at the end of last week in terms of the CDC guidance, et cetera. The staff right now has been working on sourcing some of these masks for EOC as well as city employees. We've also had some partner agencies who have requested assistance with sourcing some cloth masks as well. The library, once again, their creativity stepped up and hey, we can actually help facilitate that with our maker lab. So they jumped in and helping out from that perspective. Logistics, we have an order of 1,000 cloth masks, and we're working with a local vendor, TerraTech, on a mass production component, and we expect that to be up and running this week. And again, the operations continue with the Peterson Barn site, and we'll be looking for the need for more shelters and sites if we need to. This morning, I sent out how we go through the decision-making process here in the EOC. It's very structured. We refer to that as the planning process that runs 24 to 48 hours. And within that, objectives or needs that come into the EOC are created as an objective. We make them what we call SMART. We make them specific, measurable, achievable, realistic, and timely. So that's how we get SMART objectives. And then we move forward through our planning process and we identify resources that are going to be needed to complete the task, as well as are there any particular tasks that need to be assigned to that. And then it goes to it gets finished up in the planning process and then sent over to operations to execute. And that's all part of our emergency operation or emergency action plan, or EAP, which is produced every 48 to 72 hours within the EOC. So let's talk a little bit more about long-term community recovery. We've been looking at communities across the country that are a few weeks ahead of us as far as their response efforts. And the hope has been to try and glean information from our staff on what we can start doing to prepare for the long-term recovery. So essentially what the liaison officers, the OC manager, and much of the staff did is looked across the country to similarly positioned organizations or cities, connected with them and said, hey, where are you guys at? This is what we're doing. What can we expect going into the future? And they gave us some information back as this is what we're seeing. I'm very pleased to say that the reason we're able to start having this discussion and working on our long-term community recovery plan now is because we responded very early in this incident in our response mode, right? So we got on board with this. We didn't dilly-dally. We recognized when we started on this voyage that we had a spinning compass and we're in a fog bank. But now that fog is lifted quite a bit, and we have a general heading on our ship now. And so that allows us to start looking to the horizon, which is that long-term recovery piece. So the fact that we responded early, we've got our response phase down. We know what our four-pronged approaches is as we continue to move forward. We're connected with our partners. We can now have the resources to start looking forward. So kudos to the team for responding on that early and getting us to a point. So our next focus is going to be developing a strategy for decommissioning the designated temporary shelter sites when warranted, based on triggers in the data such as sustained drop in cases, and also in consideration of interactions with other city services as well as county services and facilities. We're also looking forward. We'll be shifting our resources and public information towards long-term community recovery. There are a number of topic areas that we'll be gearing up for that long-term effort, including business and employment recovery, housing assistance to help decrease the chance that additional people will become homeless due to the financial impacts of the virus, development infrastructure such as incentive programs and public-led projects, cultural services and activities that contribute to our local economy, and also health and social services in collaboration with our local partners. With that, I talked a little bit about those trigger points and demobilization, et cetera. And so from my seat at the Incident Command Post, we're starting to see certainly plenty of information in the media about we're going to return the economy, et cetera. When is this going to end? What's the endpoint look like? And to make it pretty clear, the caveat is the crystal ball is still pretty cloudy. We don't know when that is. So earlier this week, Dr. Ledke, who's our county public health officer, recently gave out some potential criteria that they're looking at from the county level as to what would we be looking for to start loosening some of the restrictions that are currently in place. So the first one is just the falling COVID cases over 28 days. So, we start seeing those decreases in those cases. And why 28 days? Because 28 days is 2 times the incubation period of the virus, right? So we've all heard the 14 days pretty regularly. We times that times 2, so we're at 28 days. So that's a pretty significant period of time, but it helps kind of set that lens, and that course as we're looking out on the horizon. The next one is the availability of local laboratory testing, and that has to come up in our region. And the reason for that is because we want to be concerned about if there are more cases or it reemerges. We can have rapid case identification. We can isolate those folks and or quarantine them early on, which is one of the struggles that we've had in this particular case, right? We haven't had the testing capacity to say, you have it, you folks don't, you folks need to get isolated. So local testing needs to come up in capability. Sufficient contact tracing resources. So this is a public health piece. And so there's a group at public health that when someone does have contact, then they go out and trace back the contacts and make contact with those folks so they can see where the virus came from, who was for potentially patient 0, provide information and health information to those folks of how they can protect themselves, their family, the community, et cetera. While we have been fortunate in our lower case number here and the resources we have in Lane County, we also have to be mindful of smaller counties that don't have nearly the same resources. But if this popped up in their county, it would be difficult for them to track those folks. Plans for a rapid scale up in case of a second wave. I think we've seen some scintillation there in some of the other countries where there's been some potential reemergence. That's a potential reality we need to plan for. So if we come out of this and we get through the summer, for example, and then in October, November, there's a second rise up that comes, we need to have plans in place as to how we will manage that. How are we going to spin the healthcare community back up again for a second wave? And that carries into sufficient PPE. We've all seen the shortages we've experienced with sufficient PPE. We come out of this process too early, and we go right back into one, and we haven't reestablished our PPE supplies. We're going to be right back to where we were at the beginning of this process. So sufficient PPE is going to be a big one. Another one that Dr. Ludke addressed was a blueprint on the process of restriction relaxation. And so specifically, it's like, what is that blueprint for education of the general public, the business community, and other important entities when it comes to the process of relaxation? Our restaurant, the example I thought it was great is, are restaurants going to be the same? Or is part of coming out of this going to be, well, restaurants under the new restriction or relaxing restriction it's by reservation only, and they can have 50% of their tables full in an effort to keep more physical spacing as we transition out of this. Maybe waiters are wearing masks or gloves. We don't know what that new reality is going to look like for us as we come off the backside of this curve. And the other one is Oregon Health Authority support for the restriction. We have to recognize that we are one of 36 counties in the state, and we're one of 3 states on the West Coast. And I think that was clearly identified earlier this week with the collaboration of the governors on the West Coast coming together and say, we're going to be in this together. We're going to work together collaboratively through our health associations and march out of this together. And I can't laud them enough to, I'm all about collaboration and cooperation, especially in my seat, and help protect our entire West Coast as we come out of this. So I hope this provided some updated information and what I'm seeing from where I am, et cetera, and certainly happy to open up to any questions folks may have.
Thank you, Chief. It takes me a couple of minutes to get myself back in a place where I can see everybody. It looks like, I thank you. I just want to, I thank you for that very thorough report, very interesting and very inspiring. So I'm excited at the thought that because we got going early, that we are now in a position to really anticipate and plan for a recovery. So that's really, really good news. Okay, I have Alan and then Claire in the queue. Alan, take it away.
Thanks, Mayor. With regard to the Governor Brown's announcement in coordination with Washington and California governors, I was wondering how that matches up and is consistent with Dr. Lidke's 7 that you just went through. How that, I know that as Dr. Fauci said, the timeline's actually determined by the virus, not by us. But how do those two things match up?
I can't speak specifically to that. I can only speak to what I've read through articles and through some professional journalism things. But it appears that there are similar discussions in all 3 states. And I would propose that, again, I can't speak for them, but I would propose that the health authorities in each state are talking and collaborating about that, because it's all the same virus, same challenges, same issues.
Right. Okay. Yeah, I actually really like the run through of the triggers for opening up. That makes a lot of sense. There's a lot of actually groundwork that you guys will be doing to make sure that happens. So Godspeed to you and make sure all that happens. And also, obviously, we're going to be shifting to a recovery plan sometime. So we have so the 28 days of decreasing cases, we haven't actually gotten there to day 1 yet, have we?
Yeah, I don't think we're there to that point. However, I would, again, lean back to Lane County Public Health on that and let their epidemiologists make that determinant at that point. So, yeah, I don't want to speak specifically to that. Then that would be me predicting where the epi curve was, and I don't want to get caught for speeding.
Yeah, right. But until we start seeing that decrease starting to happen, we're still a month out at least.
Right. So what we're seeing right now is that plateau piece, and we want to maintain those plateaus. It's good for us to see, in our county, if we're seeing what I would say, as I will quote Dr. Lucky during a clinician briefing, onesie twosies is a good place for us to be. We don't want that to be rising into higher numbers or even double-digit numbers on a daily basis.
Good. Now I can use onesie twosies as a technical term because Dr. Lucky said it. Thank you for all the work that you've done, all the getting the hand washing stations out, the tents, and the sites and the operations team. One of the things we asked about the other day on Monday was what is the criteria for and what are the sites associated potentially for these temporary tent sites that we have, and maybe the city manager has that, or so what are the criteria? What kind of sites do we have? My guess is that these are pretty limited. And how does it get
what I would say is I could run through the list of factors that we consider when we're looking at sites. And those include, but not limited to, access to city facilities and power, the size of the lot, so we can allow for adequate physical spacing, servicing the site, getting other traffic through, et cetera. Availability of geographic distribution, access to our geographic distribution sites like Whitebird, et cetera, as well as our outreach teams, adjacent lots and locations to allow for more than one site in proximity. So that's to assist with social servicing staff efficiency. So for example, if you look at the Amazon and Hilliard, they're in close proximity. So the same social service group can manage both sites. And so that's a level of efficiency for us. So we want to look at that as well. Whether the facility was closed during the shelter-in-place order. So, for example, our community centers, library, et cetera. And then whether staff would be regularly present on site to provide some degree of site supervision, in addition to the contracted service providers. So those are just some of the items we look at when we're looking to site our temporary designated shelter sites.
And maybe you can also address those are pretty broad criteria. So seems like there's lots of places that potentially has to be city controlled too. So any parking lot almost fits that criteria. A large parking lot.
Sure. I think one of the pieces is, one is, which you mentioned, Councilor, was do we own it? The other one is power, electricity, et cetera. So if you start going, do you have access to those things? You can certainly throw out the simplicity, like in our wild environment, we can start running generators, but then we start running into elevated costs associated with that, maintenance of that,
right,
24/7, et cetera. So those are some big things.
Okay, thanks.
Claire.
Thank you. Thank you, Chief. That was an excellent update. Really appreciate the thoroughness of your review and particularly the numbers around our costs so far, how that breaks down, and then our service to folks who are unsheltered. I just I had a question and a comment about the mask making, the local mask making, just putting the final touches on a newsletter to our nurses out at Riverbend and Peace Harbor about community mask making support with retired Riverbend nurses collecting and making masks and working actually with Marley's Monsters. Was part of our sustainable business work this last year, donating and dedicating a lot of their time right now to making masks. So I was curious in terms of the mask making effort that you mentioned, who you expected those masks to be distributed to.
So I'm going to talk about that in twofold. So one is masks for staff and employees, fire folks, et cetera. From that perspective, we're working with a vendor that can provide a product that one is a little bit higher grade than your simple Joann fabric type of model, which adds another kind of a better level of protection. The other part is we can control the production, so size, fit, washability, et cetera. We're also can issue multiple of the same masks to employees so they can rotate those masks. The other part is I'll be able to visually see as a fire chief, I'm going to see, okay, our folks are wearing the right mask, if you will. Now, with the homemade type masks, as a matter of fact, I have a few of the Marley masks down in the EOC right now. And well done. And so many of those, so a couple of the things that I look for in these types of processes, so we go back to our donation discussion, is not all donations and not all masks are made of the same craftsmanship or quality. So those are some of the things we look at as well. So, I've seen a couple where, they had some like old elastic and literally we kind of stretch them out, see how they are, the elastic breaks, et cetera. So we want to do a little bit of an inspection type of process. The other part is how old is the fabric? Do you hold it up and it's actually kind of transparent because it's fabric you had on the shelf that your mom bought 20 years ago with fire trucks on it, hoping to make it, a sheet someday. I can say that with the mom that has a lot of that. So we take those ones, kind of do a quick inspection, and now what we can utilize is we can assist those back to the public is one. So like Lane Transit District, the requirement of wearing a mask to be on an LTD bus, we're able to push some of those back to them, throw them in a basket, maybe they're on the bus. So, someone isn't marginalized for the fact that they simply don't have a mask and can't get on the bus. I would say another one is our patients. So we could distribute them on all of our resources. And so, again, someone simply doesn't have a mask, or, hey, got plenty of donations here, here you go. We take you to the hospital wearing the mask, and it's complimentary with every ambulance ride. And so those are some of the ways, also our outreach teams and also the Whitebird Clinic and at our designated temporary shelter sites. Those are all great places that we can utilize those particular products in a great positive way.
Great. Thank you. That's great to hear.
Okay, Emily.
Hi, thank you. Thank you very much for the report and all of this work. And why don't we have a sink yet at Monroe Park? There's 2 potties and a lot of people are there and there's still no sink. I'm concerned. And I've asked several times, so
Okay.
get a sink.
So
What?
is that a hand washing station?
Yeah, a hand washing station. No, I wanted to bring my dishes down. Yeah, please. I'm wondering what the reaction has been in the neighborhood to the Amazon and Hilliard sites, because I know there were a few people who were upset, and I'm wondering how that's going. Has it settled down? And what's happening in the Peterson Barn neighborhood, because I'm reading that people are similarly upset as they were at Monroe Park. So how are those situations evolving?
So I've got Laura Hammond sitting next to me, and the reason why I'm asking her is because they've got the line on the social media piece. And from what I understand, unless someone else jumps on here with specifics, certainly in the beginning, there were some folks that came over to the Amazon and Hilliard area sites and had some discussion with our folks. We did some additional posting of signage and then and educated some folks. There was 1 or 2 comments on social media, but we haven't heard a whole lot of discomfort back from those 2 places. That facility's been running now for over a week and have settled in nicely. I know the information group actually went out yesterday and they were working on maybe a video for you all and then for public release as to how things are going over there with some interviews. As for the Peterson Barn piece, other than, I've heard what Councilor Evans, I don't know if he's on with us today, express some discussion. Other than that, I haven't heard anything specifically, unless some of the other folks have heard specifically some issues.
Just emails.
I'll jump in here. I think a couple of things. Some of the messages I've received about Peterson Barn and actually early on about Amazon were a little bit people jumping to the conclusion that we had set up permanent rest stops, permanent camps in the parking lots, and not understanding that they're a very temporary emergency response. And the second piece is that I don't think people realize that we're screening, Whitebird is screening and placing people very specifically that they have confidence are going to stay in place. And so the reality of what's happening there is actually much better than what you would see if we had just had a first come, first serve. So hopefully we'll continue to communicate with the neighbors and deal with issues as they come up. And hopefully this isn't a long-term issue.
Thank you. Although we do have a long-term issue of where to shelter these people. So I can see why, with it happening now, neighbors would be concerned that it might be that way forever. And if it's not there forever, we still need to find other places. So we're going to have more sites as they're needed. It would seem to me that they are needed now. So is it still because of service providers, or how do we decide what when they're needed?
Yeah, our biggest right now we're in a holding place because my task through the city manager is the managing component of a virus. So I'm looking at it from a scientific perspective, and that is, what's the progressing of the virus piece? And so do I need to put more people into sheltering, isolation more, et cetera? And those are the things I'm looking at in terms of adding more capacity into that system. It's not necessarily that there are folks that need more specific sheltering. It's a question of, do I need more of this type of sheltering to support our four-pronged approach that we have worked with the county on to help mitigate this incident? So that's the piece that I'm looking at it from, is from a healthcare perspective and the incident commander at the EOC of what are the resources that we need to expend to mitigate the virus. That's the lens I'm looking at through.
That makes sense. That's the right lens for you. And I hope the other lenses are also taking note of how it's going and what we're learning as we need to continue having shelters. What about the youth shelters? That's been going back and forth on emails for a while, and I think it's under the radar. So could you update us on the possibilities for sheltering youth and the discussion on that?
So Sarah, I know, didn't you send an email out on this from the county earlier this week on that?
I didn't. I'm wondering, I see that, and she'll probably hate me for this, I see that Brooke is over in the attendee piece. I'll say what I understand about this, and then you can jump in, Brooke, if you have more information. But pretty much the county has been very focused in their efforts to just contain the public health issue. So very early on, they identified that the population they most needed to house from their public health perspective was the very most vulnerable adults that had underlying health conditions, which is what led to the opening of the respite centers. And they didn't feel that they needed to focus on the youth because they didn't find that group was at risk. So from a very clear public health perspective, they didn't add that into their operational planning unless one of the youth was diagnosed with COVID, and then of course then it becomes part of the public health issue. So there's been some kind of ongoing conversations in the community and pressure to open a youth shelter during this process, but it's so far the direction has been that's not our public health focus. So it's really more of a policy question of, do we want to open a youth shelter and how do we fund that? And what I understand is that there's still some energy happening about this. There's some potential private donations and private funding opportunities, and we'll participate in those conversations and see if there's a place where we can be a partner in that without fully taking on a additional cost of housing it on our own.
I get it. We do have two situations, the virus and our housing problem.
Exactly.
You know, I want to scoot as much solution as I can into the present opportunity. I want to remind everybody, while I have this chance, to keep giving blood because we need it. That hasn't stopped just because people are home. And another thing I'm really concerned about is the stimulus dollars that you can get if you have a tax return or you're on Social Security or disability. And if you don't have those things, you don't get one unless you go online and sign up. And you really only need an address. If you have a social security number, that really helps. So I'm hoping that everybody, the service providers, all of us, anybody who interacts with someone who may not have the ability to access the web to get that done or doesn't know about it, because not only will it help everybody who gets the money, and in some cases this could be a first and last rent. It could change lives, and maybe a little more globally selfish. The more money we get into the city, the more money is spent here. So let's get the money. Thanks.
Okay, thank you. Mike, you're up.
Thank you, Mayor. Thank you, Chief, for that report. That was very, very well done, very informative. I want to say a big thank you to you and to the manager again, and certainly to all the staff that have been doing the extra duty and the extra effort and all the hard work to keep everybody safe. I think that the numbers that you mentioned, the county numbers, strike me as lower than I expected, and that's a good thing. I don't have a sense of where we are relative to a peak or the beginning or the end, and that's kind of what I wanted to talk a little bit more about. Was the governor mentioned yesterday in her press conference having a data-driven recovery and a data-driven response from here, and I think that's really an important idea. Is there any way that you can, or the staff can, begin to publish the county's information, if the county isn't doing it, I haven't looked, of daily reports of new cases so that we can see it relative to the curve? We've been talking a lot about flattening the curve, and if you ask the question, are we? I don't know that I've seen that new case daily kind of curve plotted out. And I'd really kind of like to see that to know where we are locally. Another thing is, with regard to timing and recovery, Alan hit a point there that was important to me and kind of took me by surprise too, that we don't know if we're at day one of the 28 days before we get started in the process of calling ourselves moving towards the end of this, however you want to phrase it. So we're at least another month in the condition we're in, and we've got 7 people in the hospital. And did I hear that correctly?
Correct.
So
According to the Lane County Public website,
we're not anywhere near swamping that system. It would also be interesting data to know what their capacity is as well, so that we know where we are as a county relative to the health, not just Peace Health, but everybody relative to the capacity, so that we know how well we're flattening that curve. That'd be very interesting to know. But in this process, there's an awful lot of people who are losing businesses, who are really hurting. And I want to make sure we're making those decisions well. So I wonder if we might also get data on percentages of unemployment claims relative to past times. How many people in our community are out of work? And transition this to the people of our community that we're monitoring, more so than just the city organization. Thank you.
did you want me to tell you what those resources are now, or okay?
Please.
I don't have any kind of response you or Sarah want to give to any of that.
Sure. So certainly start. The answer is with the data set you're asking about. Yes. This morning I sent an email to mayor and council with there's about 6 or 7 links in there, and again, those are the ones that I look at on daily on a regular basis. Within the section under Lane County Public Health, there's a link to their COVID-19 site, and it lists all of that information you were looking for. There's a graph on there that you'll see that are such as like cumulative cases, et cetera. And then there's another one in there that shows what they refer to as the epi curve, which is the epidemic curve. And you'll see that graph in there as well. If you want to take it up 10,000 feet and look at it from a state perspective, I provided in there a link to the Office of Emergency Management, and there's a link in there that gives the daily stats, and you can actually drill down, or it actually focuses in there like number of available hospital beds, number of available ICU beds, et cetera, from a state perspective. Then they also provide a lot of demographic information. So if you want to see that breakdown by age or race, et cetera, that information is available. And then they provide more of the state level EpiCurve information. And then you drill down a little further and it will talk about our status currently in many of our emergency support functions. So it will talk about the supply chain. It'll talk about ESF8, which is our medical care. It'll talk about ESF6, which is mass care, and gives you a stoplight approach as to where we're at a state level. And that's produced daily. That usually comes out in the afternoon. And then if you want to go to 30,000 feet, I provided a link in there to like some national data sets that you can look at, and you can drill down again to the state side of the house and see what those curves are looking like, et cetera, and leave much of that up to your interpretation as to how you interpret that. But there's some great frequently asked questions in that email. I recommended that you read those, and helps you interpret that data and what you're seeing. I personally find it very fascinating, and if you need more than that, let me know. And again, I'm happy to have a data conversation with you.
Thanks, Will.
As to what the percent of unemployment piece, we'll have to get back to you on those pieces, unless Sarah, you have more to add on that.
No, I was going to just say that one of the next presentations that we'll do for you will be from one of our teams that's working on the recovery piece and some of the economic recovery planning. And I think they'll be able to give you a lot of those numbers in that work.
Excellent. Thank you.
Yeah.
Okay, thank you very much, Chief. Thank you for that really excellent report. Do I still have some? Oh, Betty. Go for it, Betty. You're still on mute.
I'm on mute.
There we go. Now you're good.
I'm okay.
Yep.
Thank you. Okay, I have comments and a few questions. A comment as one who lives fairly near Amazon Park, and I walk in the park frequently. I do hear concerns from people. Are you hearing me now? Yeah, okay. So I would like to point out that both of those, the site at Hilliard and at Amazon Community Center, are both at Amazon Park. So that's a lot of people who are camping in Amazon Park, and there are people who are concerned. My questions: where were those people before they went there, and where will they go? Can they go back to the same place? Did they just suddenly appear from somewhere, or what? They must have been somewhere before they were in the park.
Chris, do you want me to answer that?
Yes.
Yeah, start and I'll support you.
Okay. Well, my understanding is that Whitebird is collecting that information as part of their placement, and that's part of what we're looking at in terms of the transition out of this will be, where do people come from, and how do we place them out of this? So that's, I don't have that information yet, but we've asked to have that.
I just wondered why they suddenly needed a different place that they didn't need before. But so that's information I would like. And then is the city doing anything about helping people who, many people are unemployed now, as a couple of people have mentioned before, and probably can't pay their rent? And is the city doing anything about freezing rents or urging landlords to reduce the rent, or anything against evictions?
Well, the governor has put a moratorium on evictions. We haven't done anything at a citywide level yet to address freezing rents or forgiving rents. That'll be, again, part of the recovery. And I think part of your next conversation around the Affordable Housing Trust Fund will be some of that, because I think you said in the very first time we met, where we created the emergency declaration, was hope that we would be able to do some rental assistance. So that'll be part of that discussion as well.
We talk about homelessness. This is the real risk that a lot of people can barely pay their rent each month when they're working, and now they won't be able to. Then another question is a contact tracing. Suppose the only place you ever go is a grocery store and you get the virus. How would you ever trace contacts?
Great question. And so this is actually a public health question, but I will give you an example that is actually published on their website. So on March 11th, there was a large gathering type of exposure at a local church. And so the way Lane County Public Health managed that was they made an announcement to the community that a potential person who was infected with COVID was at this particular event around this time at this facility. And if you were there and are showing any symptoms, then to give them a call or contact them. So that specific example, we had one on March 11th of this year was when the exposure was. Mm-hmm. And if you go to the Lane County Public Health website, they specifically showed how they managed that particular incident.
Would it be similar to grocery? For example, I go to the grocery store, and who knows who was there when I was there?
Yeah, I can't specifically speak to that. Again, that's a public health component. I just want to provide an example.
That's the only place that some people I know are going these days is out to buy groceries. And so if
we'll say that that's one of the factors both that Dr. Lutke put in his criteria for kind of demobilizing this, as well as the governor, that they needed to have the ability to do better contact tracking.
Mm-hmm. Okay. So you're still putting out fires, Chief?
We are approximately 308 a year.
Okay, that's so I know you're working hard. Thank you. Bye. That's all.
Okay, thank you all. I do want to wrap this up because we do have another agenda item and we're running out of time. So thank you again, Chief, for a really exhaustive report, very, very helpful and informative, and thank you for keeping us posted. And with that, let's move on to our next item, which is the proposed use of Affordable Housing Trust Fund resources.
Yeah, and I'm just going to ask Michael to jump right in.
Okay.
Hi, Mayor and City Council. This is Michael Kennison, Community Development Director, and I'm here with Stephanie Jennings, our Housing Programs Manager. I just wanted to open up before I turn it over to Stephanie to go through our presentation and just say a few things. I think we're all feeling anxious over how the pandemic is currently and anticipated to impact our local economy and the household economy of many of our residents. And we all want to do what we can as soon as we can to soften the blow and help everyone weather this storm. And that concern certainly extends to helping the most vulnerable meet basic needs like housing. It's in the spirit that we've continued to move this agenda item forward, get it on your agenda today, amid all the uncertainty and disruption to our normal processes that COVID has presented. We want to make sure we're allocating these dollars in ways that meet the greatest needs and are consistent with our community's expectations for how we use those dollars. We've recently become aware that the Affordable Housing Trust Fund Committee desires more time to continue their work on a recommendation for allocating these dollars. And we really value their contributions that they've made so far in the process. And we want them to feel like they've had sufficient time to deliberate before action is taken on allocation of those funds. So with that in mind, we'd like to slow down a little here and request that today we back away from taking out action to council focusing on discussion and feedback on the proposed allocation we'll be presenting to you. And then our intention would be to take that information back to the committee for their continued deliberation and return once that work is complete with the proposed allocation to act on. And we believe that path is important to continue to build trust with the committee and our other stakeholders, and will result in the best possible recommendation for you to consider. So with that, I'll turn it over to Stephanie.
All right. Good afternoon, Mayor and Council. I am Stephanie Jennings, and I manage the Housing Opportunities team And I'm going to go through a brief presentation on the Affordable Housing Trust Fund progress. So let me go ahead and share my screen, and hopefully this will work. Can everyone see this? Okay, great. So briefly in this presentation, we're going to discuss a progress update on the work of creating the Affordable Housing Trust Fund and the work of the committee. We're going to talk a little bit about changing housing needs and how that has affected possible uses for these resources. We will discuss some potential uses of funds and then also next steps. Okay. So progress to date, a lot of work has taken place over the past year to get the Affordable Housing Trust Fund up and running. And so one of the key components of the Affordable Housing Trust Fund is the construction excise tax, which was put in place and started collecting resources on July 1st and has been fully integrated into our building and permit services systems. We have formed an Affordable Housing Trust Fund Advisory Committee, and so they were selected in October from many applications from the community and represents a lot of different stakeholder groups in the community. We have held 5 meetings with the committee to explore needs and possible strategies. Unfortunately, we were unable to hold the scheduled meeting in late March due to public health concerns and the rapid implementation of social distancing requirements. At this point in time, in terms of the resources that are available for allocation, City Council dedicated $500,000 in general fund resources through supplemental budget number 1. And then we have received over $300,000 in CEP revenue and have an estimated $300,000 available for allocation at this point in time. So I visited with City Council in February to discuss the priority needs that we were establishing for the consolidated plan. And of course, there have been a few changes since then. And so really, the public health crisis has precipitated a significant set of economic challenges. We know in the past 3 weeks that over 270,000 Oregonians have applied for unemployment. We're also seeing increases in applications for food assistance and starting to see some data on payment of rents and foreclosures. And so what I wanted to do is to really just try to kind of briefly touch upon the primary priority needs populations that we talked about in February and identify how these needs are changing. And so when we met in February, we really can talk about the access to quality, affordable rental and homeownership housing, and recognize that we had a very low unemployment rate, that people weren't making enough money to afford available housing in the community. And so much of that discussion had focused on expanding supply. The situation that we are in now is that many people are experiencing fairly rapid decreases in income. And so the need for both rental assistance and foreclosure assistance has really emerged in a significant way. And of course, there are concerns that this is going to become an even greater need over time. I would also say that as it relates to non-homeless special needs populations, we've always tried to figure out how can we serve seniors, veterans, youth, people with disabilities in our programs and services. As we are in this new environment, many of these groups have additional vulnerabilities as it relates to COVID-19, and making sure that they are stable and housed is very important at this point in time for both their own well-being and a public health perspective. And then lastly, people experiencing homelessness. Through the TAC work, has been a lot of focus on access to shelter, housing, and supportive services to both prevent them from becoming homeless and to leave homelessness. The focus at this point in time is how to get them into safe places, non-congregate settings, and to support accessing benefits and resources that can help them weather the coronavirus crisis. So as we think about potential uses of affordable housing trust fund resources, I want to go back to the 2019 council work session that took place last July. And at that point in time, council expressed a strong interest to see the vast majority of resources be directed towards renter assistance and homeowner assistance. At that point in time, the focus of that was more around affording housing or helping people to become homeowners. What we're seeing now is a need on the renter assistance side, which has some similarities, but how to manage sudden losses of income. And so how could we use this resource to pay for outreach, counseling, benefits applications, and direct short-term renter assistance? And we know that there are area nonprofit organizations that are already doing some of these programs, but they're needing more resources to be able to reach more people. For homeowner assistance, the significant concern is how to make sure that people who have experienced significant losses in income are not in jeopardy of foreclosure. And so the types of resources that we have heard a need for are to pay for foreclosure prevention counseling, benefits applications, and also short-term short-term assistance. There are actually some foreclosure prevention resources that are still available from the last recession. And so there's efforts to try to think about how to access those resources. And of course, we know that there are more federal resources on the way. But really, it's how do you get people information that they need to be able to make good decisions and help them maintain housing stability. And then lastly, in terms of supporting residents of existing affordable housing, we know that our residents of existing affordable housing have limited incomes, and any loss means that it could destabilize both their housing and also destabilize the projects, which operate on very thin margins so that they can continue to have low rents for those residents. And so another potential use is to provide project-based assistance for rent gaps and to maintain resident housing stability. And I would include assistance for special needs projects within this category as well, as we have a number of smaller special needs projects and some of which have some unique funding models that have been challenged in the current crisis. So as we consider next steps, our proposed next steps are to reconvene the committee following this work session, return to council with a set of recommendations and allocation, develop and release a request for proposals, review and select proposals, create agreements, and then implement programs to utilize these resources. At this point in time, I'm happy to answer any questions that councilors may have. Thank you.
Thank you, Stephanie. I appreciate the this explanation of the options and the kind of sense of urgency and the shifting landscape that we're functioning in. So it feels like a wonderful opportunity that we actually have created a fund, and so that we actually have the option of using it at this time, whether or not, whatever the final decision is about how that's directed, it seems beneficial. So I now have Claire and then Jennifer in the queue. Claire, take it away.
Thank you, Mayor. Thank you, Stephanie, for the presentation and for the information in the agenda item packet. I feel like, generally speaking, the recommendations that were brought forward do reflect what Council indicated were our priorities, and then taking into account this current crisis. So I do actually really appreciate where you landed with these recommendations: renter counseling and assistance, the foreclosure counseling and assistance, and the operating support and rental assistance for existing affordable housing. I understand, and I saw an email from one of the members of the Affordable Housing Trust Review Committee that there's some consternation around the operating support piece. From even just from this little bit that you provided, it seems to me that it is a means to serve our goal of keeping people housed in affordable rental units. So I just wanted to give you an opportunity to speak in a little more depth about that particular recommendation and what in practical terms that funding would allow for.
So I would say that we have been in touch with the owners of affordable housing to really try to get a sense of how many residents have been able to pay their rent, how many have had challenges or have contacted the organizations to develop payment plans. And of course, rents were due last week. So this is very current information, and they are starting to try to analyze that information. We also knew early on about a couple of specific projects that have had significant challenges as a result of the coronavirus. And the one that I would point to is the St. Vincent de Paul Youth House, which actually doesn't charge rent to residents. It relied upon St. Vincent de Paul's retail income to pay for the operating costs and the 24/7 resident manager that lives with the young women in that facility. And so that was something that we've been in some conversations with St. Vincent de Paul regarding that development for several weeks. But then there are other special needs projects that do have some gaps. So our intention would be to allow affordable housing providers that already have a long-term commitment to providing affordable rents to request project-based assistance. And so part of this is a little bit challenging because we don't know from month to month what's going to happen. We're seeing layoffs and interruptions in income happen in pretty real time. But at least to be able to establish a fund that they could request support as they're seeing these losses occur, so that we can keep residents stable and house long-term, and that these organizations can continue to run these properties in a way that's safe both for the residents and for the managers and support staff at the agencies.
So thanks for that. So it seems to me, even though it might be labeled operating support, it is actually a form of rental assistance, but the rental assistance happens to be going to landlords who are social service providers.
Yeah. And part of this is also, this is a more efficient way for us to manage use of these resources because they are in contact with their residents. They know what the gaps are. And so the alternative would be for us or another agency to process applications individually which also is a burden for the individuals to go through that process. And so we're really trying to figure out how can we not overspend these resources, because we recognize they're a valuable source, but at least create a fund that we can then pursue what's the best way to provide assistance to cover rent gaps as needed.
Great, thanks. So I don't have any objection to the new timeline that's been laid out. I just have two quick questions. When do you expect back to council with this? And then for the city manager, I wonder if we're using some of these funds now to respond to this immediate crisis, if there might be an opportunity to backfill this trust fund with state and federal dollars that we may realize to help us through this crisis later.
That's
you might not know, but
yeah. So basically, you're saying if we get reimbursed through FEMA for some of those funds, and which could be a year or 2 years out, we would then restore that.
Yeah. Could we? You know, because we're doing things we hadn't expected to need to be doing with this money.
Yeah. Well, I think, you know, you always have the opportunity as council to kind of appropriate that money or any monies into this fund that you want to as we go forward.
Okay, thank you.
And in terms of your question about timeline, after this call, we'll be polling the members to try to find a time to meet with the committee. It's unclear if we need to meet once or if we have to meet more than once with the committee to come to a set of recommendations that we'll bring back to council. And so we'll have to work on that timeline and get back to you with what that would be.
Okay, thank you. Jennifer.
Yeah, thank you. And thanks, Stephanie and Mike, for this presentation and also for doing such a quick pivot. I know you guys were already working on this and really had to make a lot of adjustments rather quickly, so I appreciate the work you're doing. Thank you to Claire for asking those questions. I had wanted a little more information about that too, and that all seems very reasonable. I think supporting our most vulnerable affordable housing folks only makes sense with these funds. So I am very much in support of that. This might be coming, you're planning to come back with this when in a later date, but these two allocations for $225,000, are we going to get a breakdown of how much of that is going to admin costs and how much of that is going to go directly to folks in the community?
We can definitely provide that.
Yeah, I would appreciate being able to see that breakdown of what we're expecting to go to these hotline services, counseling, which I think is all very important, but I would appreciate seeing the breakdown.
You're on mute, Mayor.
I'm on mute. Sorry, Alan. There you go.
Thanks. In the absence of COVID, this wouldn't have been my preference for how to spend this money. But with COVID, I think this makes sense. And I do appreciate the pivot that was necessary and the ones that you did and that you did it in a very efficient manner. With the federal and hopefully state money coming in to help people with rents, that's not something we have the resources to be able to deal with much or be able to provide. So, but what we can do is, and what we really need at the local level is the more capacity to handle the volume of people and helping them navigate this whole morass and system, and also to shore up operating support of some of the facilities that would potentially go out of business. So, and this certainly fits within my priorities of this program, which were to prevent homelessness and to create affordable housing. So I support the proposal as made. I would point out that had we implemented a full CET instead of half of it, we would have another $300,000 right now, which we would certainly could use right now.
Okay.
I would just add one comment and to underscore Councillor Zelenka's point. It was mentioned earlier that there are economic impact payments coming. Councillor Semple mentioned that there are some requirements that you need to have in order to access those resources. And so part of the homebuyer assistance and renter assistance could be to help people access those other benefits, which are significant amounts of resources, which are far greater than the resources we have available through the Affordable Housing Trust Fund or other federal resources that are coming. And so it really is a way to leverage the small amount of money to create a much larger benefit for people in the community.
Yeah, just to underscore, this is a stressful time and people are dealing with a lot of different things, and this is going to be complex for some folks and for most people, and having these additional resources and capacity to help them navigate is going to be really an important part to prevent homelessness from happening.
Mm-hmm.
Okay, thank you. And Chris, you're up.
Thank you. I really appreciate the pivoting also, and the fact that we're doing things today the way we're doing them. And what I'm hearing is there's really kind of two parts to the conversation. There's the immediate short-term part, which I think we've got a really good handle on in terms of trying to be nimble and figure out how to use this money to best effect in the short term. And then in the longer term, since this is a fund that's going to be around for a while, to make sure that we have set up a strategy and a set of policies for how we're going to use that money over the long term. And so I'm really supportive of getting the committee back together again so that they can continue their dive into what are their recommendations they want to make to the council for the best use of that funding for the long term. And what I would encourage, and this is just my opinion, but I think we should encourage them to look at all of the options for how that money could be used in greater depth and not necessarily be constrained by only what the council at a meeting back in February off the cuff decided this is how we think you should spend the money. I mean, I think that's helpful and it's informative, but I would not want to constrain this committee to say you can only look at these options because this is what the council wanted in February. I think they should do the research necessary to come back and say, we've looked at all the options when we think this really represents the best bang for the buck in terms of how you could use that tax money. So I guess what I'm saying is I think we should maybe free them up a little bit to look at all the options and not only the ones that the council decided were the only ones they could look at back in February.
Councilor Pryor, just for the sake of clarity, the council work session in February was when we discussed the priority needs for the consolidated plan. Council met in July of 2019 to discuss the Affordable Housing Trust Fund, and that's when the initial guidance was provided related to the use of funds.
Great, thank you. That even makes my case, I think, even more clear that it was over a year ago. So thanks for that.
Yeah, absolutely.
Okay, we have about 2 minutes left. Anybody last minute comment? Thank you all. I think informative discussion. We look forward to circling back on this one. I appreciate all the questions that were asked. And with that, we are adjourned. Thank you.
Thank you.
Thanks all.